Dear students, my name is Jordan Simeonov, and I would like to present the adverse effects of exposure to pesticides on reproductive health and pregnancy. Being in contact with pesticides is harmful, especially during pregnancy. It may lead to miscarriages, spontaneous abortion, preterm births, low birth weight, birth defects, and later to learning problems in children. Research indicates that children exposed to pesticides, either in utero, refers to unborn child, prenatal fetus, or during other critical periods, face significant health risks, including higher incidence of birth defects, neurodevelopmental delays and cognitive impairment, childhood brain cancers, autism spectrum disorders, attention deficit or hyperactivity disorder, endocrine disruption. The risk depends on the toxicity of the pesticide ingredients and how much of the pesticides the mother and the baby are exposed to while pregnant. During pregnancy, the baby's brain, nervous system, and organs are developing rapidly and can be more sensitive to the toxic effect of pesticides. This is the title page for presentations of the Erasmus project Toxoer, Learning Toxicology through Open Educational Resources. And now let us go back on the topic and include some more details. Pesticide exposure and pregnancy. The contact with pesticides is harmful, especially during pregnancy. It may lead to miscarriages or spontaneous abortion, preterm births, low birth weight, birth defects, and later to mental developmental problems in children. Pesticide exposure can happen in the first weeks of pregnancy, which is the most dangerous time for exposure. Pesticides and reproductive health. Pesticides are endocrine disruptors and interfere with the body's biological signals. Chemicals pass through the body quickly, others are carried through blood and tissue for years. Pesticides are harmful to the reproductive system, killing or damaging cells, resulting in infertility. Fertility in both men and women is reduced, and the sex ratio, fewer boys being born, could be altered. Adverse effects of pesticides on reproductive health and pregnancy. Pesticides have different levels of toxicity and pose risks during pregnancy. The risk depends on the toxicity of the pesticide ingredients and the time of exposure. During pregnancy, the baby's brain, nervous system, and organs are developing rapidly and can be more sensitive to the toxic effects of pesticides. Early exposures to environmental chemicals result in subtle, invisible changes that are not evident until much later in child's development. Children exposed to pesticides in utero or unborn child or later face significant health risks, birth defects, neurodevelopmental delays and cognitive impairment, childhood brain cancers, autism spectrum disorders, ASD, attention deficit hyperactivity disorder, ADHD, endocrine disruption. The next chapter considers the effects of the agricultural pesticides. Pesticides in pregnancy, agricultural pesticides and insecticides. The greatest risk of exposure to pesticides is during the first 3 to 8 weeks of the first trimester when the neural tube or brain development is occurring. If the pregnant woman lives near an agricultural area where pesticides are being used, it is advised that she should remove herself from the site to avoid exposure. Some of the journals which publish on related topics are Annals of Oncology, Epidemiology, Toxicology and Applied Pharmacology, Journal of Neuroscience, Occupational Environmental Medicine, American Journal of Public Health. Next, we will consider the adverse effects of domestic pesticides on reproductive health and pregnancy. Pesticides in pregnancy, domestic pesticides and insecticides. There is no clear evidence that the exposure to pesticide products used at home has an adverse effect on the fetus. There are reports that 3 out of every 4 women are exposed to pesticides around the home. It is observed that pregnant women exposed to household gardening pesticides had a small risk increase for oral clefts, neural tube defects, heart defects, and lip defects. Adverse effects of domestic pesticides and insecticides on reproductive health and pregnancy. Helpful information on pesticides or insecticide use during pregnancy. The pregnant woman must avoid using pesticides or insecticides at home, on the pets, or in the garden during pregnancy. The contact with pesticide products must be avoided, especially during the first trimester when the baby's neural tube and nervous system are developing. However, the pregnant woman must realize that the real risk for her baby comes only for long-term or intense exposure to pesticides. Recent studies of the transgenerational impact of toxic chemicals, including pesticides. Transgenerational effects is the impact of toxic chemicals, including pesticides, on generations of offspring which have no direct exposure to the chemicals. Toxic impacts of chemicals can affect not only the immediate offspring, but could be passed on future generations. It also can move from previously exposed to these pesticides, pregnant women, to fetuses through the umbilical cord. Such effects on the reproductive systems are a result of chemical gene modification or changes in the epigenome, while the corresponding research is called epigenetics. At the end of the presentation is the closing page of the TOXOR project, where you can see the logos of the participating educational institutions from 7 European countries.